Good afternoon. I'm Sandy Lozo, RCMA's Practice Support Liaison. Thank you for joining us today for our Essential Performance Benchmarks presentation. RCMA was pleased to announce Unislink as an RCMA business partner, and today we get the benefit of their expertise with a presentation by their Chief Revenue Officer, Patty Peets. Patty's career includes leadership roles at companies like Conifer Health and WebMD. She's passionate about using data to help physicians optimize their revenue. Welcome, Patty.
Thanks for having us. We are super excited to be here today and super excited about being a partner with RCMA. So thank you again for being here today. Y'all have a lot going on and a lot that's being offered. I hope today you'll find beneficial as well as a lot of the other things that it looks like y'all will be doing over the upcoming weeks. As Sandy mentioned, we're a full RCM company. We've got over 3,000 providers across 45 states. We've got best shore operations. We've got years and years and decades of experience in the RCM business. And we're a very data-driven organization, which is part of what we'll talk about today, is the essential performance metrics that can help improve your revenue cycle management. But, you know, there's certain things that every practice needs to know when you're looking at your monthly revenue. And you certainly want to understand your gross profit, your net income, because that really reflects the reimbursement that you're getting, to make sure that you've got available money for reinvestment, other initiatives that you might have. And those are things that the stakeholders are really interested in looking at. Your average profit per visit is something that's a measure that every practice needs to know to make sure that you're operating at the level that you should per encounter or per visit, and the cost per visit, because the cost per visit versus what you're getting paid and your profit per visit is what determines your financial health. But there's a lot of KPIs that you can look at when you're looking at your revenue cycle. We look at MGMA and we rely on MGMA best practices for a lot of the things that we do, and there's a lot of data that MGMA offers. One of the things that, if you look at a recent poll that they did, you know, this says, are costs rising faster than revenue? Well, there's a poll that says like 90% of the MGMA members said that cost is rising faster than revenue. But the four top biggest challenges that MGMA members notated was that 58% of them responded with staffing challenges, 27% said revenue challenges, 20% said expense challenges, and 4% for many other things that are challenging the practice. If you think about just staffing and revenue alone, those are two major things that are impacting practices when it comes to the stress and the challenge of making sure your profitability is where it needs to be. So, you know, why are you here at this webinar today? You know, if you're thinking about, you know, is your staff experiencing frustration when you're trying to accomplish certain tasks throughout the day? Do you frequently think that there's a better way to achieve a desired income? Is there a performance measure in your group that seems as though you've hit a plateau and it's not what you really think it needs to be? Do you feel like you're leaving money on the table? All of those are typical questions that practices have when they're not as financially healthy as you would like to be. Or sometimes it's the CEO or the CFO that's asking questions about, where is the money here? Why is this money down? There's a lot of different things that can trigger different elements of indicating that there might be a challenge or there might be a struggle somewhere in your revenue cycle. And so if you think about these different events, I kind of call them trigger events, because if you're looking at the financial triggers, such as you've got a cash flow drop, you've got physician reimbursement that's down. I know that all physicians are going to experience a cut in 2025, and that would cause a little bit of a dip in what the reimbursement is going to be. But is there a bigger physician reimbursement decrease in what they're seeing? You may have an increase in technology costs. You might have a high percent of your AR over 90. Your days in AR may be trending upward. You may have lost a physician. You've got additional physicians, but you don't have the appropriate staff to maintain the additional physicians that you're adding to the group. All of those types of things I consider financial triggers. And then you might have some other administrative triggers, which are things like you have a loss of a key billing staff member, staffing being the number. 58% of all practices think staffing is the biggest challenge. When we're talking to prospective clients and even our existing clients, we find staffing to be one of the biggest challenges that we end up talking with clients about. There's a high turnover in businesses across the country for lots of different reasons. You've also got some growth that practices are trying to become more scalable and grow their business, and that creates even more staffing challenges. Um, Sometimes administratively, I'll be talking to a practice who just can't seem to get insightful reports out of their system. I consider that an administrative trigger. And there's lots of other triggers. There's a lot of mergers and acquisitions going on. You might have new relationships, new affiliations, joining an ACO. There's lots of other things that might be happening out there that kind of fall into that other trigger. But all of these events that you may be experiencing are are indicators that it may be good to make sure that you have a really good pulse on what your key performance indicators are and how you're benchmarking against other practices. MGMA also another. This is also a very this is a poll that was done that looked at 2024, and 60% of the medical groups reported that claim denials were higher in 2024 versus the same time last year when that poll was done. And then recently, talking to many practices over the last 3 to 6 months, it seems like a recurring theme. So denials do seem to be up, and they do seem to be increasing with certain payers. And you may be experiencing that as well. Just another trigger event. But I mentioned in the beginning that we're a very data-driven type RCM company, and we use that data to really help us identify a lot of things. And Sandy mentioned that we are offering any of the members today a free assessment where we can go in and analyze your data and do a financial assessment of your data. And the real benefits of looking at the data like that is for us to help you identify if there are areas where you're underperforming or losing money. Those things could just be a lack of effective follow-up processes. It could be that maybe there is a fee schedule issue that is causing you to underperform in certain areas. But also identifying what that profitability is. So if you are hearing from leadership that the profitability is a concern, what areas are you most profitable in, and why is that? And what areas? I remember an assessment we did not too long ago for a really big allergy group, and they do a lot of allergy shots, and we needed to dig into their data to determine how profitable their shot room was compared to their other visits that they were doing. So those are some of the examples that you could look at. Another example is really looking at injections for some different specialties and whether or not those injections are profitable. The injections, because there's such a high cost associated with those injections, it's very, very critical that the reimbursement is as high as it possibly can be, and that every effort in getting those claims paid is an effective follow-up and denial process. But it can help you identify lots of different risks and problems. One thing would be to look at your denials and really understand where is the bulk of the denials coming from. That could be front-end operations. It could be somewhere in the middle with coding. It could be back-end operations, just not effective or efficient follow-up with your denials or rejections, something along those lines. And if staffing is one of the challenges that a practice is facing, more than likely there are some things that aren't as effective as they need to be when it comes to the AR follow-up. But also, if you are experiencing a decline in reimbursement or there's challenges in different areas, really identifying how much it would cost you to fix those particular areas. You've got to identify where the areas are first. Then you have to look at, well, what is it going to cost to try to fix these particular areas, and really identifying how to fix it if the problems are identified. But more importantly, it's just to determine what's the health of the practice. How are you benchmarking to MGMA? How are you benchmarking maybe to some others in your peers in your specialty? And that can give you a lot of insightful information. There's a lot of benefits in data. This is another poll that was done from MGMA. And about 39% of the medical groups said that they benchmark their data at least quarterly. And about 41% only benchmark their data yearly, and 15% say they never benchmark their data. And so hopefully you are benchmarking your data. And if not, towards the end, we'll talk more about how you could take advantage of the assessment that we're offering for all the people that are attending today. So I've been doing this for 33 years, I think now. And I've heard people say how many of these assessments I've done. I've heard people say 3,000, and I've heard a couple of people say 4,000. I think 4,000 is kind of like the fish that got bigger and bigger. But I probably have done close to 3,000 of these over my career. And so I feel like I wanted to just share the top 10 reasons that I think, that I find medical practices do lose money or leave money on the table. If you are failing to have comprehensive policies and procedures and good oversight controls, that probably is a very easy way where money could be leaking out just because maybe there's not a good adjustment process and things might get adjusted before they should get adjusted, or things aren't getting adjusted that should be looked at. You've got unapplied payments that are never applied. You've got credit balances that aren't worked effectively. There's lots of different things that happen in every corner of the business, and you really need to understand and have very good procedures and oversight controls in every single area. Another big area is failure to measure your KPIs, which is what we're going to talk about today. Hiring the wrong people, the wrong number of people, which is kind of the staffing, failure to work denials adequately or taking unnecessary write-offs, inadequate focus on the patient or the insurance or both, failure to verify eligibility, front-end type things that are happening, but just not staying current with billing rules and regulations. These are just some of the top 10 reasons that I find on the why practices are losing money. And some of the top KPIs that every practice really should measure when you're talking about your accounts receivable, you want to look at your AR over 120, your days in AR, your insurance days in AR, maybe your total AR per physician, your total revenue per physician. And then we're going to talk a little bit about gross collection, revenue realization, net collection rate, and your average reimbursement per visit. And if you have insights into your denials, that's a great place to really start understanding what's happening that may cause any of these KPIs to be not as healthy as they should be. So why should a practice know your KPIs? I've said this I know I've said probably 4,000 or more times in my career. If you can't measure it, you can't improve it. And so that's kind of what we're going to focus on today. So one of the very first metrics that you want to look at is your AR over 120. Look at your total AR. What percentage of that is over 120 days old? Less than 25% of your AR definitely should be less than 120 days. Less than 25% of your AR should be over 120 days old. Preferably, you want that to be in the 9 to 15% range. And if you're only looking at your insurance AR, you really want it to be even less than that. I mean, if you think about it, if all of your processes are firing on all cylinders, that insurance AR should get adjudicated, paid, and a appropriate adjustment done within a 120-day window. And it even has time to go to the secondary, get paid, go to the patient, and get paid in that 120-day window. That's ideal, and that's what you're going to want to look at. If your AR over 120 is higher than 25% or even higher than 20%, you want to make sure that you understand what is in that AR over 120. Is it uncollectible? Is it patient responsibility? If it's uncollectible insurance, you really need to understand why. Why is that insurance getting to 120 days at all? What are your write-off policies? What are your follow-up policies? What does your denial management processes look like? Is all of that documented very well? If it's patient responsibility, not great news, because you're less likely to collect patient money once it hits that 120-day bucket. So you really want to understand what are your collecting copay processes, what's your eligibility verification, your pre-authorization processes. Are you collecting amounts that are applied to the deductible? Are you doing that as early in the revenue cycle as you possibly can at the point of service? Are you making it convenient for your patients to pay? So there's a lot of things that you can look at if it's mostly patient responsibility that is causing that AR over 120 to be higher than it should. This is just a quick way to calculate it. We left some of these in the slides so that when you get a copy of this, if you need that calculation help, that will be there. But if you think about what are some of the causes, if you do have an unhealthy AR over 120, inadequate denial management, credentialing issues, lack of resources, which would be a staffing issue, inadequate claim scrubber, maybe you're not scrubbing the claims well enough, because here's the ideal goal. What you want is you want those claims to go out the door as clean as possible. And when I say clean, I just mean they're not going to get rejected. And so you should try to have a 100% clean claim rate. So at least you have the best chance of it getting paid. That doesn't mean that there won't still be denials, but at least they're not going to get rejected. You want those rejections to just go to zero. Failure to verify the front end part, failure to verify the insurance eligibility, failure to collect patient balances in a timely fashion or an effective manner. Maybe your charge lag is too high. Sometimes I was working with a group just the other day, and it's taking them between 30 and 40 days to get some of their charges even entered in the system. Well, if your charges aren't going to get entered for 30 or 45 days from the date of service, then of course your AR over 120 is probably going to be higher, and your days in AR is definitely going to be higher. So you want to kind of think about some of those things, inadequate prior authorization, and sometimes ineffective coding. So there's either usually a coding issue or not so much. But if you are having a coding issue, that could certainly cause the problem as well. And I kind of already mentioned a lot of this, but what the impact of that AR over 120 is that you've got timely filing that's going to be at risk if your AR over 120 is higher than it needs to be. And it also typically indicates that insurance is not getting followed up as quickly as it could be, or maybe not as effectively. And if you go through with our assessment offer, I will typically take every KPI and try to convert it to like a dollar value that says, okay, if this KPI was healthier, it would mean that you could have maybe a one-time influx in cash of X dollars based on your volumes and your numbers. It doesn't necessarily mean that that money's lost, but it definitely means in my book that it's at risk now because it hasn't been collected within a 120-day window, and there is a risk there that it will not get paid as effectively as it could if it had never reached that old. Your days in AR is another very common AR KPI. It's the average number of days it takes a practice to get paid. You can look at that days in AR. Some people think it's the most significant KPI. I don't necessarily agree with that, but it is very important because if you think about days in AR, it's the average number of days it takes you to get paid. And if you look at the way that it's calculated, there's two ways to get your AR down. One is to get paid, and the other is to adjust it off. So if things are getting adjusted off inappropriately, your days in AR might look better, but it doesn't necessarily mean you're collecting all of your money. So you got to be really careful about just relying heavily on your AR over 120 or your days in AR. You want to look across all KPIs to get a really good understanding of what the true financial health is. But as far as your days in AR, typically we want to see that in the 30 to 40 range as a healthy. I think MGMA has kind of pushed that number up just a little bit. And some people think that it should just stay below 50. I think 50 is way too high. But you ideally you want that days in AR number to be 30 to 40 or even below 30. And there are benchmarks that really exist for many of these KPIs based on the specialty. This is, again, a calculation on how to calculate that. And then I'm not going to read through these again, but if you think about what are the causes of unhealthy days in AR, they look pretty familiar with what we just went through, right? The same types of things that would cause your AR over 120 to be much higher than it is, that it should be, is the same thing that would cause your days in AR to be higher than it needs to be. And then your average reimbursement per encounter. This starts to get into some of the reimbursement KPIs that you want to look at on a regular basis. The average reimbursement per encounter is just the average amount that you're going to get per visit or per claim or per encounter. When that is benchmarked against your specialty, it really will give you a sense of where you're performing based on the procedure mix that you have. There are some things that can cause this to be a little bit different than the benchmark. Depends on your payer mix, the procedure mix, some things like that. But you can start to break that down into procedure category, and then you can see, well, what's the average reimbursement I'm getting for E&M codes in general? What am I getting for surgical procedures? What am I getting, like in the example I gave you, allergy serums? Different procedure categories that you can break that in, and that can be very helpful when you're doing an assessment. But it definitely is something that should be looked at because it's really hard to get this KPI wrong because you've got payments that are coming in and you have a total number of visits that you did. And so it's just your, let's see if I have a calculation. I don't have a calculation, but it's basically your total payments divided by your number of encounters. And there's no way to really kind of look at the formula to have anything factor into that. It's just straight up, how much are you getting paid on an average per encounter? It's an easy one to calculate and can be very, very insightful. As I mentioned, denials, you always want to have insight into your denials. The percent of your claims, both pended and denied, really require that you perform back-end work. So if you can get that denial rate down, then there's going to be less work that has to be done on the back end, which can help you with staffing. It can help you with a number of things. But you really want that to be very, very low. And if you remember, I think it was 68% of practices said that their denials had increased in 2024. And so this is a real problem for many, many practices. But you want this number to be 4% or lower. That is a great benchmark. If you are having denials and your denials are greater than 4%, you really want to understand what's getting denied. Why are they getting denied? It's going to fall into like one of 5 different categories. It's going to be like eligibility, coverage related type things, authorizations, coding, credentialing or enrollment, and then process type questions, right? When it comes to maybe additional information. And then if you can take your denials and then break them down into those things. Is it authorization? Is it benefits? Is it billing, bundling, coding, eligibility? That will help you pinpoint where is the main area that needs improvement in your revenue cycle to try to get that denial rate down. And then you really want to understand how are you working those denied claims and make you've got really effective denial management strategy and processes in place to do that. Very similar causes of high denial rates. All of these problems can cause all of your KPIs to be unhealthy, but specifically around denials, you've got to understand that front end operation. Sometimes I'll do an assessment and literally over 40% of all of their denials may be front end related with coverage related, and eligibility and authorizations are really big. Like I said, if coding's an issue, sometimes it's an issue. So I may see 30% of your denials that are coding related, or maybe there's 2%. So it just depends if you have a coding issue or not. Many of them will fall under the billing type process, additional information, maybe medical necessity, areas like that. But if you can get insight into your denial report, it will really start to point you in the right direction on what's happening. And then I mentioned I was going to go into the gross collection, the revenue realization, and the net collection rate. Checking my time here. And so these are your reimbursement KPIs. Gross collection is a simple one. It's the percentage of your gross charge that you're collecting. You take your payment divided by your charges. That's the percentage. There are benchmarks, but your fee schedules really impact what that gross collection rate is going to be. So for example, if you're 2 times Medicare, typically you're going to see a gross collection rate close to around 50%, somewhere between 45 and 55%. If you're 4 times Medicare on your fee schedule, you might see a much lower 30%, 28%, something like that, depending on what your specialty is and what would justify why you're running at a 4 times Medicare fee schedule. And there are reasons that you would do that. And so your fee schedules impact that. So it's a little bit hard to benchmark. It's more important to benchmark against yourself when it comes to the gross collection rate. So you know what your fee schedules are, your fee schedules are where they need to be, and maybe they're not. Maybe it's time to renegotiate your fee schedules, renegotiate your contracts, and then see if your fee schedules are in line with maybe a new contracted rate with the different payers. But what you're going to do is it's better to benchmark against yourself, because then if your contracted fees are what you need them to be, and then your fee schedules are what they need them to be, then you should be able to determine what is the healthy gross collection rate that I should expect. Maybe it's 50%. So then now what you want to do is you want to look at it month over month, and you want to look at that gross collection rate and make sure that you're staying at 50%. Because what you'll typically see is it might be 49.5, 50.2, 50%, 49.8, 50.4. It's going to stay right in that area. As soon as you see that drop to 48 or 47, then you know that there's a problem. And then you could look at that gross collection rate broken down by provider, by payer, by procedure category if you need to, and find out why that gross collection rate is dropping. And that is the best way to trend your gross collection rate. So it's a very important KPI to look at month over month and make sure that you have a good pulse on that. I kind of already mentioned some of these things, but the causes of a low gross collection rate would be that fee schedule or the reimbursement contracts aren't what they need to be. But basically, if you're not collecting all of your insurance money or your patient responsibility, or you don't have good denial management processes or ineffective front end, then all of those things could bring that gross collection rate down. Let's see here. And then revenue realization rate. This is one where it is the percentage of your charges that were either collected or adjusted off, regardless of the adjustment reason. And I want you to hear that, because the adjustment reason is going to play a role in the next KPI that we talk about. But regardless of the adjustment reason, that means if it's a contractual adjustment, if it's a bad debt write-off, if it is a collection agency write-off, any of the adjustment reasons that you could possibly have, even if it's written off because somebody failed to get the authorization, therefore you had to write it off because you couldn't get paid. All of those adjustment reasons fall into this category. So you want this to be 99 to 100%. And let me explain the reason. So if you're going to ideally back up at least like 90 days. So when I'm really looking at my reimbursement, if it is February, then I want to look at maybe December of 23 through November of 24. That would give me a 12-month window. And I'm not really going to look at December or January or February, because I know all those claims haven't gotten fully adjudicated. But I could back up 90 or 120 days and look at 12 months. And then I had plenty of time to get all of those claims adjudicated. So I want them to have either been paid appropriately adjusted off or maybe written off, depending on what the denial reason and your adjustment protocol is. But if you look at it that way, then you should be at 99 to 100% because 199% of everything that was charged out has either been paid and or adjusted off. And that's what the revenue realization rate is. And this is something that I've done a couple of times, and it seems to kind of I've seen it kind of turn a light bulb on for a few people. So I'll run through it. I hope it's not boring, but this is, if you think about the revenue realization rate, you've got to be careful because I have seen some people look at this KPI and say it's their collection. And I've had people say, "Oh, we're collecting 98%, right?" Which would be fantastic if your net collection rate is 98%. But when I look at it, it's like, well, that's your revenue realization rate is 98%, which is good, but your net collection rate is actually running 91 or 89 or 88 or less, right? So there's a difference, and I want you to understand the difference here if you get anything out of the webinar today. Think about this. The ideal scenario, your practice is billing out timely, all the claims are adjudicated, the contractual adjustments are made, the patient balances are all collected, everything is going really well. You're going to have a very high revenue realization rate. But think about this. The practice is billing out timely, the claims are all adjudicated, the contractual adjustments are made, the patient balances aren't collected at all, but they're all getting written off to a collection agency. You're still going to have a high revenue realization rate. Now, the worst scenario is you're billing out timely, all the claims are adjudicated, and they're denied. Contractual adjustments are being made, but there's also other adjustments being made that may even be disguised as contractual adjustments, but they're really just getting written off for things that went uncollected that maybe could have been collected if they had been worked properly, and your patient balances aren't getting collected and they're getting written off to a collection agency. You still are going to have a high revenue realization rate. So the point is that you could have a 98, 99, even 100% revenue realization rate, but it doesn't necessarily tell you, are you collecting all of your collectible money? Because you have to pay attention to the adjustments. And so if you think about the net collection rate, and admittedly, can be very tricky to calculate, and it's sometimes not something that you calculate on a regular basis. You kind of dig in and calculate. But if you can back up 90 or 120 days and you can analyze the 12 months prior to that, then the net collection rate is going to tell you the percentage of reimbursement collected from the total amount allowed based on your contractual agreement. So you take your gross charge, subtract your contractual adjustment, that should be your net charge, the amount that you should be able to collect. And then what percentage of that did you collect? So if you look at that formula, it doesn't include all of the bad debt adjustments or write-offs because things didn't get collected. It only includes the contractual adjustments, or if you just looked at it from an allowed amount standpoint, what percentage of your allowed amount are you collecting? And if you're able to calculate that, then it's telling you the story, because there's no way to really maneuver that number. It means that if you take cash collections divided by the net charge, which I've just described, but if that number is high, then your practice is billing out timely, your claims are adjudicated, contractual adjustments are being made, and your patient balances are getting collected. That would produce a high net collection rate. And if the number is low, it typically means something is wrong. Either you're not billing out timely and the claims aren't getting followed up on accurately or effectively or efficiently, and the balances are not being collected after the payer adjudication, but bottom line is the money may not be collected. Now, you do, like I said, it can be tricky to calculate because if you have a lot of claims that are still not adjudicated and all the contractual adjustments aren't reflected in that number, then it can get a little tricky calculating it. But it is by far the most powerful KPI that you can look at. This is the calculation. It shows you how to do the calculations on all of that. And it kind of gives you an idea of comparing a net collection to a revenue realization rate. That a lot of times when you do that calculation, you may come out with 98.7, which is a revenue realization rate, and you're thinking that's my collection rate. But in fact, if you were to dig in and really calculate what that net collection rate is, you might find a different number. So hopefully that's helpful and insightful for some people to look at it a little bit a different way. I think we kind of already talked about this, but the most important thing is to back up 90 days and try to analyze the 12 months prior to that when you're looking at any of the reimbursement type rates. So what are some of the causes of a low net collection rate? Well, there's some of the same causes that we already talked about. If you've got ineffective front end eligibility verification authorization processes, that could definitely cause your net collection rate to be low. The best way to determine if you have issues in those two areas is to look at your denial reasons and see if you're having claims denied for those reasons. Again, if you're short-staffed, if you're having staffing challenges, that can definitely, more than likely, if you're having staffing challenges, it absolutely corroborates KPIs that aren't healthy. They usually go hand in hand almost every time. If you have some coding issues, that could cause it. Inability really to measure and monitor that on a regular basis. Like I said, to me, it's one of the top 10 reasons I find practices who are leaving money on the table is because they don't have really good monitoring of their KPIs on a regular basis. If you have credentialing issues, obviously that's going to cause problems. And just what your denial management and your write-off policies are they effective enough to make sure that those are getting followed up on? So that is some of your major KPIs that you do need to look at on a regular basis. And then I thought what I would show you is just an example of the revenue cycle assessment that Sandy mentioned at the beginning. And this is only a few of the slides that we typically do. We usually look at all those KPIs that I mentioned if we can have access to all the data that we need to calculate them all. But then we would look at transactions, and we want to look at transaction trending, charges, payments, and adjustments over time, and see if we can see any trends. We would definitely look at the accounts receivable and kind of see what's in those buckets and what's in those buckets by payer and every way we could slice it possibly. Look at your denials if you have good insight reports into your denials, the reimbursements that we just got through speaking about, and then really kind of talk about what are next steps on helping us identify for you where the areas are that we think would show the most improvement opportunities. But this is an example. So these slides came from real assessments that we did. You would see a summary of your KPIs. You can see this example. For example, you've got a net collection rate, an adjusted net collection rate, the average reimbursement per encounter, the AR over 120. That one's pretty good right there. And the days in AR is pretty good too. But see, this is a good example too, where I don't know which client this was, but if you look at the AR over 120 and the days in AR, those look pretty healthy. But the adjusted net collection rate of 89 is absolutely not as healthy as it needs to be. You want that to be 95, 96, or 97. And so there definitely is room for improvement when you're looking at the net collection rate, but your AR looked pretty good, right? So that's why you need to look at all of your KPIs. And then this is some examples of trending. You want to look at transaction trending. It's really interesting because when you start to look at your transactions, sometimes the data, you'll see little blips and peaks and valleys in the data. And it's kind of fun because then you'll say, well, did something happen in October? And somebody will say, oh, yeah, that's when we did, X, Y, or Z. And that totally explains the graph that you're looking at. And so we do lots of those. I thought I had a sample in here. But anyway, there's another sample that I've shared with other people, and it's because it is so, it's not even believable. You go and you see this one graph that does this huge spike right in the middle that like goes higher than all the other graphs. And it's like, whoa, what happened there? And they had written off $7 million in that month. From they had done a big cleanup of their AR. So anyway, it's the graphs will start to tell you the story. But what you're really looking for is like parallel lines. So you want to see your charges, your payments, and your adjustments, and you want those lines to be parallel. These actually look pretty parallel, but sometimes what you'll see is they're not parallel at all, and your payments are really dropping flat. And then again, sometimes you'll see those adjustment spikes, and that means that there was some serious cleanup being done to adjust some things off. But we'll do some trending. We definitely look at your accounts receivable. We'll look at the different buckets. We look at insurance versus patient. We'll look at the a breakdown. I don't have, like I said, I only picked out a few slides, but when we do an assessment, sometimes it's 30 pages of data that we're reviewing with you. But in the accounts receivable, we usually break it out by payer, maybe by financial class. Sometimes we'll do it by provider, depending on the conversation that we have that indicates that it might be helpful to look at it by provider. So we'll slice that up as many different ways as we can, trying to provide as much insight as we possibly can. Then we get down to the reimbursement trend, and that is that gross collection, revenue realization, and net collection rate month over month. And so like this example that we're looking at here is January 23 through December 23, and you can see the charges, you can see the payments, you can see contractual adjustments, you can see write-off adjustments. These would be like your bad debt write-off, and then your total adjustments, and then you can see this gross collection rate averaging 39.6, your revenue realization rate, which is running about 87.7, which is not as high as it needs to be, and then your net collection rate, which is dreadfully low, is 74.12. And so if you look at the gross collection rate, kind of what I was saying, you're looking at 39.6, but look at the revenue realization rate. So if you go back and think about January of 23 in this example, 94% of their charges was either paid or adjusted off. Then it was 92, then it was 93, then it was 91, 91, and then you start to see it drop way off. The net collection rate, it doesn't look like they ever had really a stellar month when it comes to the net collection rate, but you can definitely see that it used to be higher in the first 5 months of the year than it was the other 7 months. So that's an example of what we do when we look at the reimbursement trend. Depending on how much detail we get in the data to do the analysis, we'll start breaking that down as well. So if you overall, your reimbursement trend is showing unhealthy revenue realization and net collection rates, we'll try to break it down into the payer to see which payer is really driving that down. Sometimes you'll break that down by payer and you'll see, well, for Medicare, you guys are doing pretty well. You're at 97% net collection rate, but these 3 commercial plans are down in the low 80s. And so what's happening? And then that will drive you into drilling down deeper into your data. Let's go look at Blue Cross denials specifically and see what's happening there. So all of this data will help drive you in the right direction to further the conversation. The goal is just to find out where are the areas that need to be improved upon. And ideally, what you can do when you're looking at that reimbursement trend is you can say, okay, you're collecting at a 74% net collection rate. If you were collecting at 95, you would be looking at collecting 7.4 million instead of the 5.8 million that you did collect, which is a $1.6 million difference, right? So that came from a real assessment. I don't remember the client, but that came from a real assessment that we did. And that's what you're really trying to uncover. How much opportunity is out there for improvement in the revenue? And I just think KPIs will tell you the story that you need to know. Knowledge is power in all aspects of life, I feel like. So run your reports, calculate those KPIs. And a lot of this you may already be doing, but if you're not doing it, maybe you can use this presentation today to go back and look at how are things getting calculated, just compare what's in the presentation to what you're currently doing. Run those reports, calculate every KPI that you possibly can. And I'm not trying to disparage any software that's out there that has dashboards. I think dashboards are beautiful and everybody should have dashboards. But don't just take a dashboard for granted. Look at the numbers, do the calculation, and make sure what the dashboard is telling you is the same thing that you're calculating when you do it manually. So pull those numbers off of reports, do your little calculations, and gain that confidence that you need if you do have dashboards, that the dashboard is telling you what you want to hear. But calculate those KPIs and then benchmark that data against some source, whether it be MGMA or previous historically what the practice has done. Dig in deeper wherever you need to, because I absolutely can assure you that KPIs will tell you more than you probably would ever want to know about what's happening with your practice and everything that you need to know. And so that's why you want to conduct that analysis. And you can do that analysis yourself because you want to identify if there's areas that are lagging. You want to calculate any financial impact that it's having because the KPIs are not what they need to be. It helps you evaluate the quality of your staff. If you can evaluate the quantity of staff that you have to make sure that you're not understaffed, and re-examine your processes. If you're finding that you're having a lot of eligibility issues, you need to re-examine those processes and revamp them. And if you are having a lot of problems and you do want to look at a solution where maybe somebody like Unislink or somebody else is coming in to help you with that, examine the cost it's going to cost you to fix those problems and make your performance better. But those are the benefits of why you want to conduct an analysis. And as we mentioned, if it's something that you either don't have time to do or don't have reporting tools that are helping you do it easily, or if it's too complicated because of reporting limitations that you might have, any of those things, if you want us to come in and do that assessment, we're happy to do that. And so, like we said, who we are, a full RCM company. This is something that we're offering the RCMA members specifically, that we will offer to do this analysis for you. And we will come in and provide you with as many indicators and key risk areas and improvement opportunities that we can identify by assessing your data. And we're more than happy to do it with you as a partner. No obligation on your part to do any business with us. It's just a free offering that we offer our clients. And if we do find some areas that look like there's an opportunity for improvement, we just ask for a conversation to see if Unislink might be a partner that could help you with that. But there is the QR code that if you scan that, you can request your free revenue cycle assessment, and that's exclusive for RCMA members.